Hi, I'm Dr. Evan Parks, and I'm the author of the book, Chronic Pain Rehabilitation, Active Pain Management that helps you get back to the life that you love. In this segment, we're going to be talking about habit formation. Recently, we did a video on how to do the calm breathing exercise. Now, the calm breathing exercise can be very effective in helping people manage pain. The problem is, you have to practice it regularly in order to make it effective. So I'm going to talk you through how to develop this habit, because most people that I share this with struggle with developing it into a habit. Now, I've shared this with many people over the years, and I can see some of the common mistakes that people make in trying to use it. The first mistake that people make when they hear about and practice the calm breathing exercise is that they're going to use it as soon as pain flares up, but they don't really practice it that much, or maybe not at all. That's a mistake, because when we do the calm breathing exercise and we're doing it when pain flares up, and the brain hasn't any other connection with this breathing, it's going to associate the pain with the breathing. But what we really want to establish is that when we're doing this breathing exercise, we're inducing a calm, relaxed state. That's what we need to establish first. In order for that to happen, we have to practice primarily when there is less discomfort. There's never going to be a period when there's no discomfort, but at least when we have less, when we're not in excruciating pain. So I'm going to walk you through some of the habits. So the first habit that you want to have is to set a time. You can plan at least this as a minimum, that you're going to do it sometime in the first part of your day and sometime at the last part of your day. For most people, that's going to be sometime in the morning and sometime in the evening. Secondly, you're going to set a timer so that you do it for 5 minutes. And you want to use a timer. You're not going to be looking at a watch or a clock or anything like that. Just set an egg timer or your watch or your if it has a timer, or your cell phone or a tablet or something like that, but set a timer for 5 minutes. Next, you're going to need to be in a place where it's quiet. It's so important that you're undistracted. People aren't going to be walking around where you're practicing this. TV's not going to be on, radio's not going to be on, music's not going to be playing. You're going to be focusing your attention. So that's the next piece, focusing the attention. So you really need to drill your attention in on something. It could be the movement of your stomach while you're breathing, because we're doing diaphragmatic breathing with this exercise, and the stomach goes out and in with each breath. Focus your attention on that. Or you could just follow the air as it passes in through your nose, into your sinuses, down your throat, into your lungs, out your mouth again. Just picture following the breath. That's another really common strategy for focusing the attention. Feel the cool air coming in through the nose, into the sinuses. Feel the warm air leaving your body. The third suggestion that I have for focusing your attention is counting your breath. So as you breathe in your mind, you say 1. As you breathe out, you say 1. As you breathe in again, 2, 2. And you just do this breathing pattern where you're counting each breath up until 10. Now, if you're like most people and you're like me, you're going to get to about 4 or 5 and your mind's going to go off someplace. That's fine. Just have compassion on yourself. Gently bring your attention back to your breath. Start counting again. Go from 1 all the way up to 10 and then start again. So you're going to set a time. You're going to set a timer for 5 minutes. You're going to practice twice a day. You're going to be in a quiet place. You're going to focus your attention. And then the next thing that you're going to do is you're going to extend the length of time that you practice from week to week. So to do that, first week, you set the time for 5 minutes twice a day. Then the next week, 6 minutes. Then the next week, 7 minutes. On up to 10 minutes twice a day. Research shows that when we are doing this breathing exercise with focused attention, at least 10 minutes at a time, we are extending the length of time that our mind and our body stay in a calm state. And when we talk about neurofeedback, which is going to be in a later episode, you're going to learn how our brainwave activity is very important when it comes to managing pain. And you want to maximize that by doing this breathing exercise correctly. So these are some of the strategies. They're very simple, and you can implement them in your life starting today. Now, a really important principle to keep in mind is this, that we are hard on ourselves when we make mistakes, when we forget things, when life gets in our way and we don't keep our word. We are really, really heavy on putting guilt and pressure on ourselves and telling ourselves that we're no good for not doing what we say we're going to do. Now, if your mind is like that when you set out to do this exercise, because if you set out to do this exercise, you can just be guaranteed that life is going to get in your way. So be compassionate. Listen to all that noise in your head and just say, thank you, mind, for telling me how bad I am. Yeah, that's the same old song that you're always singing. I know it pretty well, but thank you for reminding me. And just have compassion on yourself. When you're doing that, you're giving yourself the foundation that you need to start again. And that's all we can do. When we feel like we failed or we feel like we have not kept our word to ourselves, all we can do is start again, and that new beginning is a great place to begin afresh with confidence that we can go further the next time. So I hope you find this helpful. I would love to hear your questions. Please send them to me, and you can contact me through painrehabsource.com. Send me your questions there. And if you're interested in hearing this presentation in a podcast version, you can look at the podcast called Pain Rehab Podcast, available on any of the platforms you might be using. So I look forward to talking with you again, and I really look forward to hearing from you. Take care.